Let's head over now to Embarking in Mpumalanga, where we do understand that the Premier of the province is addressing the media. Let's listen in.
Those cases are in Steve municipality. Close to 25 of those cases are in Dr. J.S. Moroka. So hence we are here in this district to make sure that we kept the spread of COVID-19 and we monitor it very closely. Those that have already been tested, we treat them and make sure that we combat the spread. And of course, it makes sense to have those cases around here because of our proximity to Gauteng, as we know that the prevalence around Tshwane is quite high. So most of the people around this area, they will commute from Emalahleni, Dr. J.S. and Steve Tshwete to Gauteng. So for whatever business that they are doing. So as they come back and then they come along with the virus. So, but then it's important for us that we kept it at this point and then we don't allow it to spread widely in other areas of our province. And we must indicate that thus far we have already received the certificate of excellence from the President in the eNCA district as one of our municipalities that are doing well in terms of the vaccination rollout program. So we want to see the same translating to Nkangala district and also Gauteng district. Hence we are saying that our program will extend it up to the 12th in terms of the Vuma campaign to make sure that we encourage our people. And of course, we will be stationed here full time to make sure that we work with the municipality in making sure that we get as many of our community leaders, our social network influencers, so that we speak to them. We come up with one program where we will encourage and make sure that we get as many of our people to get vaccinated.
The percentage you're speaking about is around 30-35, I'm sure, and your target was 70%. What are some of the findings you made in terms of the hesitance, in terms of why people are not vaccinating? If you can just give us that in one sense. And then the second question is, National has also taken a perspective that they must look into mandatory vaccination. What is the standpoint of the province in terms of that? And just the last question for myself, the issue of the proximity to Gauteng, as well as the fact that it is essentially December holidays right now. What are your concerns around the fact that people will be traveling back home to spend time with their loved ones at a time when provincial borders are not there anymore? Just in terms of the traffic that will be unmonitored and guarded. What are your concerns around?
What is important is that we need to continuously make sure that we enforce the COVID-19 protocols. Our people must make sure that they adhere to those protocols. If it's not necessary for you to go out there and socialize and be with people, you rather refrain from doing that so that you try and protect yourself, your loved one, your families, your relatives, your neighbors, whosoever that you get in contact with this COVID-19. So we can't abandon the enforcement of the regulations precisely because of we want to minimize the spread of COVID-19. Now, insofar as people having to commute between Gauteng, Limpopo, and Mpumalanga, we know that predominantly this is the mining town. Emalahleni in particular, your Steve Tshwete. Obviously, it is given. Most of the population around this area, some of them are from Limpopo, some of them are from Gauteng or any other various parts of the province. Obviously, they will go home, visit their families, they will still come here. It's either they transport in or transport out COVID-19. So, hence it is very important for us to work with our mining sector as well in making sure that we create awareness and we put up systems of making sure that we join hands, we collaborate with them in terms of vaccination, testing, and the treatment as well. As you have seen, we've already done that to make sure that because of that population, predominantly that's where they are, it was important for us to make sure that we work closely with the mines so so that there's proper monitoring and they do have vaccines so that they can vaccinate their workforce. So therefore, for us, that was very much important. The issue of mandatory vaccination. Obviously, at this point in time, we rely mainly on the national scientific evidence that they have before them, which will then determine what should be the approach moving forward. Now, as soon as the commander-in-chief, the president, announces that this is the way that we need to take, for us as Mpumalanga, would really appreciate a situation where the vaccine is being made mandatory. That will help all of us so that we make sure that we are protected from the adverse effect of COVID-19, particularly protecting our people from dying out of this virus, and also making sure that they are not hospitalized, incubated unnecessarily. When they had a weapon at their hands, they could have used that weapon to protect themselves against adverse effects of COVID-19. And therefore, we would gladly welcome that decision once it is taken at the National Command Council, and immediately after that, as a Provincial Command Council, I'm the head of the Command Council, we will equally implement that decision.
Just in terms of the issues around hesitancy, what are some of those that you've identified? And maybe just to talk further, in terms of the CCC, what were some of the suggestions in terms of COVID-19 regulations, especially coming down to festive season and the identification of the new variant? What are some of the suggestions put to CCC from the province to try and stop this trend?
You know, the main challenge here, it has to do with the myth that is spread across through social medias. Now, hence we are saying that we need to get social media influencers, and in the main, those are young people who normally have more followers within their page. And if we work close with them and collaborate with them, I'm sure particularly the youth, we might be able to win them. It depends what message are they cascading down to their followers, and accordingly they will respond. But as things stand, we rely mainly as government on scientific evidence that has been put before us. As you know, that there are scientists that are looking and they are studying at this COVID and how it reacts, so what how is its mutation and all, and whatsoever the case might be. And based on that information, the information has been put before us. And once that information has been properly analyzed, there are suggestions that are derived from the analysis to say that this is the direction we think that government should take in making sure that it curbs the spread, which will then says that if there's a need that we up our lockdown levels, the president will then advise, as usual, as we all know. But then if there's no need at this point in time to do that, as we have seen that we had a meeting where it was agreed that we remain at level 1, but of course we need to be extra cautious in terms of managing the spread and also managing the infections that are already there, and also making sure that we make sure that there's adherence to COVID-19 protocols. So at this point in time, what is important is that we want to emphasize to our people, though that be as it may, even if the country is still at level 1, we want to urge our people not to travel unnecessarily. It's better to be safe, stay at home, protect yourself and your loved one from the spread of COVID-19.
That is the Premier of Mpumalanga, just reiterating the fact that there are certain COVID-19 regulations that people need to adhere to. On the issue of mandatory vaccines, of course, that needs to come from the President and this task team that has been set up.